got something.
Wow.
Thank you.
Dr. Lasota, the naturopath and homeopath here at the clinic, came in for our regular Friday patient conference and mentioned she was feeling dizzy. We both thought this would be a good opportunity to discuss the most common type of dizziness we see, benign positional vertigo, or BPV. An example of typical symptoms of vertigo would be a description like, "My head is spinning," or "the room is whirling." These types of symptoms 90% of the time are caused by BPV, but could also less commonly be caused by otitis media, Meniere's syndrome, and salt-retaining medications. If someone complains of their balance being off, which is a type of disequilibrium, we investigate more neurological possibilities. Similarly, if someone complains of feeling faint or like they might pass out, we go down a different path as well. Even a complaint such as "I'm dizzy" or "lightheaded" is a bit different from vertigo and is very likely not BPV.
Wow.
Thank you.
Both Dr. Lasota and I had some difficulty figuring out which side to do the Epley's maneuver from, since she had no nystagmus and felt symptoms on both sides of her head and around her ears. We tried doing the Epley's maneuver, turning her head to the left side. This increased her symptoms, which led us to believe that the crystals were most likely on the right side and that we should do the procedure on that side instead. There are multiple causes of BPV. Tiny calcium carbonate crystals called otoconia, also known as canaliths, detach from the utricle in your inner ear and move into the semicircular canals instead. When this happens, changes in your head position can trigger episodes of vertigo. Some causes of these calcium crystals to break loose are the result of a head injury, inner ear infection, damage from ear surgery, or prolonged back position associated with bed rest. Some additional causes I've noticed in the clinic are crystals forming during allergy season. Dr. Lasota has also noticed patients' use of very high doses of vitamin D, leading to the formation of crystals in the inner ear. However, a reasonable amount of vitamin D could also help to reduce the crystals. I have tried Epley's maneuver many times over the years with very good results. It worked again today with Dr. Lasota. If you or anyone you know is having any vertigo symptoms, please remember this technique is available to them. It's a non-invasive treatment that often gives near immediate relief. Thank you for joining us today. Please like and subscribe to help support more videos and content like this.